been said that the needs of elite athletes and grandparents differ by degree, not kind. And so all individuals have similar needs in terms of sports medicine, regardless of their athletic ability or level of participation.
Sports medicine encompasses many facets of both injury prevention as well as the treatment of acute and chronic injury, and rehabilitate all the way through rehabilitation of patients who are active, involved in sports, involved in recreational activities.
You know, you get the wrist injury from the athlete, the overuse injuries, you know, the kids getting into training during the fall and they're coming in with knee pain or shin splints. So it runs the gamut really of those injuries that you see. Typically a lot of them, either whether they're overuse or an acute injury sustained on the field or in the rink.
Main injuries involve knees and shoulders, but to be honest, it's any injury that can occur in a sports activity. Our sports participants range from young kids through people in their 70s and 80s.
I like to think of it more as allowing people to maintain the type of lifestyle they want to keep. It might be walking the dog around the block, it might be, you know, playing collegiate athletics, you know, and everything in between.
One example of that may be a Division I college football player who's deadlifting in the weight room to increase his explosiveness off the line for games, compared to your grandmother who needs to be able to squat to get in and out of a chair and maintain her independence to stay in her home.
It really is a nice specialty for those who are active, who came from sports, because you can really follow people during the entire spectrum of their activities, and as they evolve, you can evolve with them.
One of the unique things about Orthopedics Rhode Island is that we have a comprehensive team of providers that incorporate both sports medicine from non-surgical and surgical perspectives, as well as specialists in different areas that we may need to bring onto the treatment team at times. So for example, an elbow specialist, a foot and ankle specialist. But we also include rehab services as part of our model.
Well, I think one advantage, you know, particularly with Ortho Rhode, is that it's a little bit of one-stop shopping, and so there's a lot of good communication between, you know, the physician, the physical therapist, or the occupational therapist, and, you know, studies that need to be done. So there's a good flow, good communication, and coordination of care.
I think one of the things that's been great for us is the collaboration with the Rhode Island Interscholastic League. A number of our providers actually participated in the league. I played hockey and golf once upon a time, and then we have other providers here that have done the same. So that's been a great opportunity for us to sort of give back, so to speak.
Our athletic training staff is actually in the community. It's out there with high schools, seeing athletes kind of at the point of contact, and it's a seamless type of transition for a patient who, or an athlete who develops an injury, being seen by our athletic trainers while they are either at their school or while they're on the field. I can get a quick phone call or a message from the athletic training staff the next day saying, you know, we have an athlete, this person was injured. We get them in within 24 hours, being seen immediately.
We have a ton of emerging technologies, you know, within Ortho Rhode Island, and sports medicine has really been revolutionized by arthroscopic procedures, which are small incision, camera focused, utilizing smaller tools to fix things in a better way, but in a less invasive way. So we have our own little emerging technologies in sports medicine that really has worked well. I think having that really important conversation about expectations sets the stage for what are our options moving forward, and really focusing the majority of people on getting back to the activities you want to get back to?
One of the biggest goals for me in sports medicine is to maintain quality of life. A lot of athletes or active individuals identify very closely with their sport, and that's a part of who they are. So it's not just about getting out of pain, but it's getting them back to the activities that they enjoy. And so we're looking to do that in a way that's both safe, effective, and also that is going to maximize their longevity in the sport, as opposed to trying to rush back into activity too fast.
I tell everybody seeing me is kind of like a speed bump in their life. I don't want it to be a roadblock. I want it to be a speed bump. If we can help them get kind of over that and back to, down the road, that's our goal. We're patients also, and we see the same thing in us as we see in them. So we try to move them forward, try to get back to where they need to be, and kind of regain their normal lives.